Hello, everyone, and welcome to this month's Pensionmark webinar series, where we'll be discussing Social Security and Medicare. We appreciate all of you taking the time to join us today. A few items to go over before we get started. First, in order to ensure everyone has the ability to hear the information presented by our guest speaker, everyone will be on mute during the webinar. Second, please feel free to write in any questions you have using the Q&A tool on the webinar menu. And at the end, we will take some time to go through these together. And now I'd like to introduce our guest speaker, Michael Gracie. Mr. Gracie is a value add and retirement education specialist for BlackRock. He is responsible for the development and delivery of the firm's wealth management programs. He has many years of experience as a public speaker representing BlackRock as a specialist in the retirement sector. Prior to his current role, Michael was a defined contribution advisor consultant, managing 401k distribution relationships, including plan design consulting and compliance administration. Before joining BlackRock in 1995, Mr. Gracie was a senior communications consultant for T. Rowe Price, where he was responsible for participation education, strategies for large institutional retirement plans. From 1988 to 93, Mr. Gracie was a relationship manager and business development officer in Mellon Bank's Qualified Plan Division. Mr. Gracie began his career in 1984 with Mid-America Group as an actuarial analyst and defined benefit account manager. Thank you so much for joining us today, Michael, and now I'll go ahead and turn it over to you.
Thanks, Tori, and good morning, and thank you all very much for joining our seminar here. Thank you to Pensionmark for hosting the program today. Kind of getting us started today, we're going to talk about some Social Security and claiming strategies and some important information about filing for Medicare benefits at the time where you reach retirement. As financial advisors and as retirement investors yourselves, obviously making these decisions around when to take your Social Security benefits is probably one of the most important decisions you're ever going to make. And what's kind of interesting is, although we and Pensionmark have been talking about Social Security for the last number of years, about a week and a half ago, the Congress passed and the President signed the Bipartisan Budget Act of 2015, which has changed some of the claiming strategies available to many of us around our Social Security benefits, and I'm going to talk about those in detail during our call today. To kind of get us started here, one of the things that we think about is, especially those of us who are nearing retirement or the baby boom generation, is we're the first generation in the history of the planet that has ever really had to kind of consider longevity when it comes to planning for our retirement. And I want to share you some actuarial statistics that kind of back that up. I think what you see here in this slide are the results of a longevity study, and it basically kind of says down here at the bottom in purple is, hey, if a couple lives to reach their retirement age, well, there's a high probability that one in that couple is going to live well into their 90s. So baby boomers as a generation, we're living longer than any generation in the history of the planet, as I said. But when it comes to taking our Social Security benefits, in planning there is clearly a disconnect between longevity risk and what people do. In fact, Social Security Administration tells us today that almost two-thirds of us elect to take our Social Security benefits early. And when you do, they actually reduce what you're going to get. Now, I'm going to come back to this longevity risk again, but let's spend a little bit of time. Let's talk about how they actually calculate your Social Security. To be eligible for that benefit on your own work record, a worker needs to have earned 40 credits or 40 quarters. You may have heard that before. 4 quarters per year means you got to work at least 10 years to be eligible for a benefit on your own work record. And many people think their Social Security is going to be based on 10 years. But the reality is that your benefits are going to be based on the 35 highest paid years of your career. Not 35 consecutive years, but the best overall 35. Now, what you see up on our screen here, this is a copy of a Social Security statement. Your statement will show you your earnings history, which is important to check from time to time to make sure that the data looks correct. and it will also show you estimated benefits when you turn 62, later at what is called your full retirement age, or if you wait out until 70 to start. Now, last fall they announced that after some stops and starts, the administration once again started to mail these statements to us. But we're only going to receive them about every 5 years. You get it when you're 30, you're 35, you're 40, etc. Turn 60, you should get one of these statements each and every year until you retire. But today there's another option. You can also go out to Social Security's website, create an account, log in, and actually download a copy of your statement. And I would encourage you here today, if you haven't done this already, to sign up and get your Social Security statement online. Okay, let's talk a little bit about when we collect Social Security benefits. As we all know, you can start receiving reduced benefits as early as age 62. Your full Social Security comes into play when you reach what is called your full retirement age. And your benefit at your full retirement age has another name. It's called your primary insurance amount, or your PIA. You're going to hear me talk a lot about PIA. It is your full retirement benefit, but it is also, it's a key number. It's a number you need to know and potentially share with any financial advisors that you might be working with in order to do some projections or calculations around your Social Security benefits. Delay, they'll actually increase your benefit from your PIA up until you reach age 70. Now, your full retirement age, a little bit of a moving target. Used to be age 65, but back in 1983, they worried about the solvency of Social Security. Congress passed a law. They changed our full retirement age, moving it from 65 up to age 67. But as you see there, they actually grandfathered many people based on their retirement ages. In fact, early baby boomers born 43 to 54, full retirement age for you is your 66th birthday. And those of us born 1960 or later have to wait until our 67th birthday to reach our full retirement age. But you probably note there that people born between 1955 and 1959 actually have to calculate their full retirement age. Here's how it works. Start at your 66th birthday and then add 2 months every year your birth falls after 1954. Sorry that it has to be that complicated, but that's the rule the administration has set up. All right. If you elect to take your Social Security benefits prior to hitting your full retirement age, they actually reduce what we receive. And the administration, they use a monthly formula to determine how much the benefits get reduced. It is a 5/9, 5/12 formula, but the outcome of it looks what's here in your slide. If you wait until your full retirement age, you're going to receive 100% of your PIA. But for every month or year you start the benefits early, the formula reduces what you collect. And note, if you're starting at 62, you're only going to receive 75% of that PIA. You're looking at a 25% reduction. If your full retirement age is your 67th birthday, you were born after 1960, and you're starting your benefits at 62, you'd really be looking at a 30% reduction to your PIA. And the thing about the benefit reductions is they're permanent. So, as we do some planning around when to take our Social Security benefit, there's probably a couple of questions or categories of questions you really need to consider. First category of questions, working. Are you actually going to retire? Or is there a chance that you might work, and many people do, even part-time prior to reaching that full retirement age? Then we come back to longevity. How's your health? Is it good? Is it not so good? Your health, probably one of the most important factors to look at as you start your benefits. And then our last category. Are you married? Are there age differences between you and your spouse? Whose benefit can your spouse collect? All of these questions are critical to consider before you start collecting your benefits. We'll look at a few of them in a little more detail. Here's the first category, working. Let's say you want to take your Social Security early prior to reaching that full retirement age, but you continue to work. Well, you need to know there's an earnings limit test. It's probably going to impact your benefits. You see, they call it an earnings limit test, but all they really care about are your wages. They're not looking at your investment earnings. They don't care about any balances you have in your pensions or your IRAs or your 401ks. They really just look at your wages. So if I'm starting my Social Security early here in 2015 and I have wages greater than that $15,720, they're going to begin to withhold my benefits. $1 of benefits withheld for every $2 of wages above that limit. Now this first wage formula, it goes from 62, and I'm collecting my benefits, up until the calendar year I reach my full retirement age, where the limit increases to almost $42,000 in wages before any reductions. However, the entire earnings limit test, it goes away as soon as you hit your full retirement age. Take Social Security early, continue to work, earnings limit test. At your full retirement age or later, you can receive benefits, you can work, no impact. So we suggest to people that if they're going to continue to work, and by the limits, maybe even part-time, it probably makes sense to wait for their Social Security, in most cases, until after they reach their full retirement age. Another monthly formula we want to share with you today is the one that is going to increase your Social Security between your full retirement age and 70. Now, what you need to know about the formula here is the interest rate. The interest rate they use to increase benefits is actually set by law, and it's a factor of 8% per year, called a delayed retirement credit. So, summarizing these benefits, you can get anywhere from 132% of your PIA all the way down to 75% of it, and everywhere in between. Think about it. That's a wide range to your benefits. What do you do? For a lot of years, people try to figure out when to take their Social Security. There's a very common school of thought or approach to collecting these benefits. It's oftentimes referred to as a break-even analysis. And here is a slide to kind of demonstrate the break-even analysis, which says here that if I'm going to take my Social Security early at 62, and they're going to reduce my benefits by 25% versus waiting 4 whole years to start collecting my benefits, well, what's the cost of waiting? Or how long must I live to catch up? Now, you see there in the blue arrow, you got to live until you're about 78 if you want to delay your benefits until your full retirement age. Wait until 70? Well, you're going to have to live longer, about 82 and a half. Now, first of all, there are all kinds of longevity studies out there that are talking about baby boomers and future generations living a lot longer than 82 and a half. But that's not really the problem with this traditional approach to break even. The problem is that it doesn't work all that well, especially if you're married, because married couples receive 2 other benefits that single people don't get, that this break even doesn't take into account. And these benefits are spousal benefits and survivor benefits. So we'd like to talk about those next. And we kind of do this by showing you a case study, a fictional couple here. And here's our couple, Jordan and Alex. Now let me tell you a little bit about Jordan and Alex. The first thing you need to know is they're the same age. Now Jordan's got a pretty good PIA, 2,200, but our first illustration here, Alex has a PIA of 0. All right. Now what you need to recognize is the benefits are based on the higher wage earner and the lower wage earner. Benefits are not based on husband and wife or one spouse versus the other spouse. This clearly is how it works. Now, for Alex, even though he or she has no Social Security benefits of their own, they're still entitled to a benefit, a spousal benefit. And the maximum spousal benefit Alex can collect is equal to 50% of his or her spouse's PIA, or $1,100 a month. Now, in order for Alex to begin to receive a spousal benefit off of Jordan's work record, Jordan has to do something first, has to file for Social Security. Now, these rules here have changed as a result of the Bipartisan Budget Act of 2015. And I want to explain those differences here now. For any of you on the call today who were born on or before April 30th, 1950, you will be able to do a file and suspend strategy that I'm going to discuss between now and April 29th of 2016. There's a cutoff. For anyone who was born after April 30th, 1950, the file and suspend rules are no longer available for you when you reach eligible age. So, let's start first with the group of us on the call born on or before April 30th, 1950. And let's assume that that's Jordan, right? Jordan, if he files at his as early as age 62, he can entitle Alex to collect the spousal benefit on his or her work record, but by filing early, Jordan will be forced to collect his or her own Social Security. And if you file early, they're going to reduce that benefit. But if Jordan waits until full retirement age, and once again, born on or before April 30th of 1950, Jordan has the option to file for his benefits, defer it until he or she reaches 70, and earn delayed retirement credits along the way. Begin to collect the benefit at 70, and it would be 32% higher than his PIA. But the whole time, Alex can collect the spousal benefit from the point Jordan filed. This is the file and suspend strategy, a really terrific tool that unfortunately is going to go away very shortly by May 1st of next year. So, important to note, born before April 30th, 1950, you have an option to utilize a file and suspend strategy, but you need to put it in prior to that cutoff date. And you should spend some time talking with a financial advisor to get some more information. Now, for those of us on the call who unfortunately were born after April 30th, 1950, file and suspend goes away. And in that case, in order for Alex to collect off of Jordan's work record, Jordan needs to file and collect his or her own Social Security benefits in order to allow Alex to receive the spousal benefit. It's referred to as a deemed filing, collecting the benefits at the point you file. The $1,100 that you see there is the maximum spousal benefit, 50% of Jordan's PIA. What Alex actually receives of that $1,100 does depend upon another factor. That factor is Alex's age at the time he or she begins to collect. If Alex has reached full retirement age, 66 in this case, can receive 100% of any spousal benefits. But if Alex is younger, they have a spousal reduction formula that applies. And if you look over there at 62, it's actually a greater penalty, reducing that spousal benefit. And unfortunately, there are no delayed credits that are going to increase a spousal piece. It stays capped at 50% of the other spouse's PIA. So, if a spouse is looking to receive a spousal benefit, they want to begin to collect that piece no later than their own full retirement age, as there are no delayed credits to increase it. Okay, I want to switch gears here and talk about another feature of Social Security, survivor benefits. Now, here's some interesting statistics for you. Back in 2011, there were 51,000 Americans over the age of 100 getting their Social Security benefits. But of those 51,000, 44,000 recipients are women. I think it's something we all know, right? Female life expectancy is greater than male life expectancy. But Social Security tells us, for baby boomers, as you see in the pie chart on the left, over 50% of women will collect a benefit that's based in whole or in part their spouse's work records. So why this is important is, if Jordan has a greater PIA than Alex, but Alex lives longer, and Jordan decides to take Social Security early, so that benefit gets reduced as a result, what happens is you see the survivor benefit available to Alex is subject to a reduction. However, if Jordan can earn delayed credits to increase his or her own Social Security benefit, Alex is able to capture or keep those delayed credits in the survivor benefit at the end. So, this quirk or rule around these survivor benefits, plus the spousals we talked about, those are key factors that changes the break-even calculation for married couples. And that's why we suggest that if you're married, it probably makes sense to sit down with a financial advisor and go through some models, some benefit projections before you make your Social Security decisions. And that's what I kind of like to show you next. I'd like to show you some of the collection strategies as they apply to Jordan and Alex. Now, as a quick note, none of us are Jordan and Alex. We're all different ages and different benefits, right? Different health situations. But I want you to kind of see the type of analysis that can actually be done for us as we plan for retirement. So Alex and Jordan tell us they want to take Social Security as early as possible at age 62. Now, what I want you to see here is that the life expectancy in this first illustration is very conservative. Alex living until he or she is 82, but Jordan passing away at 75. Here's what it would look like. If Jordan files to collect Social Security early at 62, you see that $2,200 comes down to $1,650 a month. But at the bottom left, Jordan would collect over $277,000 in Social Security benefits from 62 until he or she passes away at 75. Alex, on the other hand, filing at 62, would collect $450 of that $600 and $350 of the $500 spousal piece. Those equate to $75,000 and $59,000 in additional benefits. Those three pieces of benefits make up their couple's Social Security during their retirement years together. But when we fast forward to 75 and Jordan passes away, Alex starts to receive a survivor benefit. They're going to be basing it on that $2,200 Jordan's PIA. And although you're not going to see it on our slide here, the survivor benefit is actually reduced to $1,815 a month. But collecting the $1,815 a month from 75 until Alex passes away at 82 is where the $152,000 in total survivor benefits comes from. So we can clearly demonstrate for our clients how much they're going to get from Social Security. And it turns out to be about $564,000 in total benefits. Here's what's important to know. If Jordan and Alex waited 4 years until their full retirement age to start collecting, they're not getting any checks from 62 to 66, but when they start, they receive full benefits. $2,200 for Jordan, $1,100 for Alex. And when Jordan passes away, Alex would receive the full $2,200 as her survivor benefit. Turns out for our couple, even though they waited 4 years to begin to collect, they actually received more in benefit, right? The reduction formulas were a greater penalty than waiting those 4 years. So it's important as a couple to model these strategies to see what makes sense. The next illustration I want to show you is what happens using that file and suspend strategy. Now, once again, with the rule changes, the strategy, as you see in this slide, is only available for someone who was born on or before April 30th of 1950. And that would allow Jordan the opportunity to file and suspend his own benefit, triggering the spousal piece for Alex. And in this approach, we were having Alex start at 62, collecting her own Social Security, but deferring the spousal benefits until full retirement age, while Jordan earned delayed credits and the 2904 at 70. At 70, when Jordan passes away, Alex would receive the 2904, enjoying all of the delayed credits Jordan had earned. This file and suspend strategy turned out to maximize the benefits for our couple. But once again, this is only going to be available for those of you born before April 30th. And you must put that strategy in place by May 1st of next year. For those of us younger, once again, in order for Alex to begin to collect the spousal benefit, Jordan would have to file and collect the Social Security benefit. So the optimized strategy in this case is probably going to occur somewhere in between full retirement age and 70 for Jordan to actually start collecting. Greater life expectancy for our couple changes the numbers pretty significantly. If you go from 75 and 82 for our couple to 85 and 92, just 10 more years together, you can see the difference between taking those benefits at 62 versus their full retirement age, almost 140,000 more in benefits, 120,000 more in benefits. And these hybrid approaches generating almost 200,000 in additional Social Security benefits. So your health and longevity are going to play a huge role in what you collect from Social Security. And once again, it's important to model based on your health and thoughts about what your life expectancy is going to be. One other strategy to talk about here is what happens if our couple has greater benefits. Jordan's PIA is $2,200, Alex's PIA is $1,400. Now, this provision is called a restricted election, the ability to collect a spousal benefit while deferring your own Social Security until a later date. This option is also eliminated under the Bipartisan Budget Act. However, it is grandfathered for anyone who has reached age 62, before the end of this year, 2015. Even though you need to put it into place at your full retirement age, if you reach 62 by the end of the year, this option is grandfathered for you. What it allows Alex, in this case, to do is begin to collect the spousal benefit off of Jordan's work record, the 1,100 we were talking about, while deferring her own PIA until later. And if she waits until she turns 70, the 1,400 becomes 1,848. She's going to step up from the spousal benefit up to her own benefit later, called a restricted application. And for anyone who reaches 62 before the end of this year, this option is grandfathered for you. For those of us younger, unfortunately, at the time we file for Social Security, we will have the option to collect the greater of our own benefits or a spousal benefit off of our spouse's work records. We don't have the option to pick and delay. Survivor benefits. A widower can collect a survivor benefit as early as age 60. At 60, you're not old enough for your own Social Security, but you can collect a survivor benefit. Here's our widow, Chris. If Chris wants to retire at 60, because that earnings limit test, the wage test I talked about earlier, always comes into play. But if Chris wants to retire, he or she can collect a survivor benefit off of her late spouse's work records. They're going to reduce it, as you see, by a lot, but Chris needs to know that he or she has their own PIA in reserve, and they could file for their own benefits later. Take the survivor benefit first, collect your own benefit at some point down the road. Most widows or widowers take the best benefit from day one without looking to see if a different claiming strategy may make a little more sense down the road. There are no changes to the collection of survivor benefits as a result of the Bipartisan Act, so these rules continue on just as before. Social Security is also designed to protect spouses in the event we get divorced, but a couple have to meet a few requirements. They are 10, unmarried, and 62. A couple had to be married for at least 10 years. The spouse that wants to collect on the ex's work record, unmarried at the time they go to collect, and both spouses have to have reached eligible age, meaning they're at least age 62. You meet these requirements, an ex-spouse can collect spousal benefits, but also potentially survivor benefits. And the amount of the benefits that are paid in divorce are exactly the same as benefits paid to married couples. No difference. If I am collecting a spousal benefit off of my ex's work record and my ex-wife predeceases me, I would move from a spousal benefit of 50% of the PIA up to a survivor benefit, which could equal 100% of my ex's benefits. So, once again, it's important to kind of recognize that these rules are put into place to protect spouses in the event of divorce. It's also possible that you can have multiple ex-spouses collecting benefits off of the same work record, as long as each of those marriages met the requirements outlined on the left. Lastly, on Social Security, it's important to recognize now they have a formula to determine how much. The formula is used to define what is called your provisional income, which is taking 1/2 of your Social Security and adding it to your modified adjusted gross income. If you're married and filing jointly and you have provisional income that's above $44,000, that's going to get you to where up to 85% of your Social Security benefits are treated as taxable income. Now, your modified adjusted gross income is adjusted gross right from your tax return, but you got to increase it by any tax-free income you might receive. An example of tax-free income would be maybe income derived from investments from municipal bonds, right? Or any distributions you might receive from Roth IRAs, Roth 401ks. You need to add that income back in to determine your modified adjusted gross. I'm going to transition here from Social Security to Medicare and talk about some of the key features involved in Medicare benefits. The first thing we need to know, right, is Medicare is a federal health insurance program for all Americans over the age of 65 or older, right? And it typically comes into a few common parts. Part A of Medicare, and that blue box, covers your hospital insurance. Part B is your medical insurance. And Part D is an optional prescription drug program. Now, you can take traditional Medicare, Part A, B, and D, and wrap it in a Medicare Advantage plan, or Part C, right? That takes traditional Medicare and wraps it into an HMO or a PPO type of environment. The other silo or approach to take your Medicare benefits is traditional A and B and an optional Part D coverage, and wrapping it in a supplemental Medigap program, which we'll talk about as well. So there are two silos to think about with regards to collecting the benefits. But as retirees, one of the things we really need to focus on is understanding the cost outside of these traditional benefits. What are the out-of-pocket costs and deductibles we must consider? First one is, let's look at our hospital insurance, Medicare Part A. And as you can see here in 2015, you have significant deductibles for a hospitalization of 1 to 60 days, a $1,260 deductible. And that is per hospitalization, right? Extended hospitalizations after 1 to 60 days, you have a $315 per day copay. So there are some significant out-of-pocket costs for hospitalization that we need to bear out of our assets if we don't have any sort of additional coverages. Medicare Part B, our medical insurance, is the part that really has the premiums that much of us are aware of. Now, the amount of premiums an individual pays is based on your modified adjusted gross income again. And it's important to recognize that Medicare uses what's called a cliff schedule with regards to these premiums. Now, for a cliff schedule, all it takes is $1 worth of additional income, and it can move your premium pretty dramatically. A one-step increase for a couple can increase their Medicare Part B premiums by about $1,100 to $1,400 per year. So once again, looking at your income planning during retirement is important when looking at recognizing what your Medicare Part B premiums are going to be. Now, there was a rule passed in 2015 that a couple of years ago, that applies for the first time here in 2015. It is a hold harmless provision with regards to Social Security and Medicare. And what this hold harmless provision says that is if I am collecting or I am paying a Medicare Part B premium here in 2015, and there are no cost of living increases to my Social Security benefits, my Medicare premium is going to stay flat. It is not going to increase the following year. There has been announced increases in these Medicare Part B premiums for 2016, with an estimate of that first tier of premium going from $104.90 up to almost $120. However, if I'm collecting my Social Security without there being a COLA for next year, my premium is going to stay flat under this hold harmless provision. If there are COLAs that increase Social Security benefits, my Medicare premiums are going to increase proportionally to those COLAs. Enrolling is another key area where people have trouble with regards to Medicare, and here are a couple of key rules to look at. If I am collecting my Social Security benefits, reaching age 64 and 9 months, I'm collecting Social Security, I am automatically enrolled in Medicare Part A and Part B. If I am not collecting my Social Security benefits, I should apply for Medicare 3 months prior to reaching age 65. Automatically enrolled if you're collecting Social Security, a manual enrollment required if you are not. For Medicare Part B, there are 3 separate enrollment periods we may need to consider. The first enrollment period is the initial window. It's a 7-month period that starts, 3 months prior to 65, 4 months after 65. And if I am retired, I need to enroll in my Medicare Part B during that initial enrollment period. If I fail to enroll in my initial enrollment period, I may then enroll in a general period, there in red, January 1st to March 31st of each year. But if I should have enrolled during the initial period and I wait until a general enrollment period, there will be some premium surcharge penalties that could apply to my Medicare. Lastly, there is a special enrollment period. It is an 8-month window after the separation or coverage by an employer's health plan. So anytime you are covered by your employer's health insurance plan, you could potentially enroll during this special window and still receive standard Medicare premiums. What this leads us to is, if I am still working when I reach Medicare eligibility age, 65, Medicare is secondary to my employer's plan while I'm working. So what I need to do or consider doing is to sign up for Medicare Part A, the part that covers your hospital benefits, but delay my Medicare Part B until once again I am no longer covered by my employer's health care, and I would enroll during that special enrollment period. Many times, individuals that are still working and covered enroll in Medicare during that initial period when it is much better for them to wait until the supplemental or special enrollment period after they officially retire. Choosing the right optional prescription drug program is really a wide variety of different options to Medicare Part D. You really want to explore what are the premiums, deductibles and copays, the costs of each of the individual tiers, what drugs that are covered, any limitations on those prescriptions, and the convenience of getting the medications, and ultimately pick and choose the right option, the option that's going to meet your specific needs. There's a wide variety of choices there. For Medigap plans, these supplemental programs, they kind of take the alphabet soup kind of approach, A to Plan F. These are plans that follow the federal government guidelines, structured and administered through the states and provided by private insurance carriers. A through L, again, they cover a range of deductibles, co-insurance, extended hospitalizations, and drug coverage as well. The most common Medigap plan is Plan F. Almost 60% of Americans using Medigap programs use Plan F. It does cover deductibles and co-insurance in excess for Medicare Part A and Part B, and a couple of other features as well. The most important thing to recognize when selecting a Medigap plan for your coverage is you need to shop around. A survey that was done back in 2011 looked at Medigap Plan F for a 65-year-old woman, and we found that premiums could range anywhere between $869 to $5,295 for the exact same coverage. So once again, it's really important that you look to shop around before you select a carrier for your Medigap programs. Lastly, here are some resources that you need to think about. Some terrific online resources are available through various state agencies. You can find them by Googling Medicare resources in the state that you live. You're going to look at whether or not you want to use a traditional siloed Medicare program, maybe with a Medigap supplemental wrapper, or take that Medicare Advantage approach and recognize what your timetables are and working with the right financial professional in looking to see what your income needs are and the best way to cover those appropriate premiums. And at that point, it kind of wraps up what we want to talk about today, and we'll kind of open it up and see what questions we might have from the group this morning.
Thank you so much, Michael. We appreciate you sharing your time and knowledge with everyone here today. And as you mentioned, we will now start addressing some of the questions that have been filtering in. Please remember that if you have any questions, you can submit them using the Q&A tool on the webinar menu. And as always, you can reach out to your dedicated service team at Pensionmark for any plan-specific questions. And that information is listed here on the screen. All right, looks like we have quite a few questions that have filtered in. Our first question for you, Michael. Will we get copies of slides? Are they compliance approved? I'm sorry, this is a question from a fellow advisor. Yes, you will receive copies of the slides and the presentation is approved. Our second question, is there a PDF that can be printed or saved for future reference? I'll go ahead and answer that one for us, Michael. Yes, following the webinar, about 2 weeks prior, you will receive a link for the webinar replay. And this webinar replay is recorded and will be posted on our YouTube channel as well as our Pensionmark website. And in that email, there will also be a link to the PDF version of this presentation that we use today. All right, Michael, our first question for you. I didn't pay into Social Security for several years when I worked overseas as a voluntary option my employer gave me. Does that affect the amount of my benefits?
Yes, the answer is that it would. If you were not participating or contributing into Social Security, you're going to have a zero wage for that particular year. Your benefits are based on your 35 highest paid years of one's career. So, it's possible that those zeros could be replaced with wages at some point during your career. An example I can kind of give you, my wife took a number of years off. We have when our children were little. But as she's continued to work later on in life, those zeros get replaced. So your benefits are based on a 35-year career average. But yes, the answer to your question, it could have an impact on the level of what your benefits could be.
Great, thank you, Michael. Our next question, is the ex-spousal benefit automatically paid to the ex-spouse if qualified, or does the ex-spouse need to apply for the benefit?
Excellent question, and the answer is they need to apply for the benefit. And this is a large part of questions that we actually get when we do these seminars across the country. Many individuals that are divorced or widowed widowed from ex-spouses don't know that they are eligible for these benefits. So when they talk to Social Security, they don't make them aware that there are ex-spouses to whom the benefits should be considered. So yeah, it's something that absolutely has to be discussed with Social Security when you apply for those benefits. I wish I could tell you it happens automatically, but it does not.
Great, thank you, Michael. Well, it does not appear that we have any more questions at this time, but as we previously mentioned, if you have questions following the webinar, you can always contact us. Our phone number is listed there for our Financial Wellness Help Center, as well as an email address that you can reach us at. So thank you again, Michael, and thank you, attendees, for your participation. Hope everyone has a great day, and we look forward to our next webinar series with you. Take care.